Go.
Go. Okay. My name is Betty Stewart. I'm giving a speech for speech class. I'm going to talk about cardioversion, pacing, and defibrillation. A poster board for you to look at. The things that you're going to need, of course, is your code card. RT, preferably. Two nurses, a doc, to give orders, or we're going to go by ACLS protocol. So, a continuous EKG if we're doing a little cardioversion, especially if we use adenosine. We need the 3 leads and the patches on. Consider sedation when possible. So we'll start with cardioversion. So cardioversion is a very tachyarrhythm that is 150, 180, 200. The patient is, let's say they're symptomatic. So they're very symptomatic and we need to cardiovert them. So hopefully they have enough blood pressure. We're going to give them some sedation. We'll prepare them. We'll have hopefully 2 IVs, maybe even a little sedation. Set your monitor on defib, and then we're going to set the joules for 50 to 100 joules, depending on what the doctor would like to do. And we're going to let the patient know that we're going to cardiovert them. We need to put the sync button on and cardiovert, do an EKG afterwards, or possible re-cardiovert the patient if it doesn't happen. With pacing, you're going to turn your monitor, the Zoll monitor, to the green arrow. You're going to look at your rhythm. You're going to start your rate first, and then start your milliamps, and you're going to turn your milliamps up until you capture. Once you capture, first you're going to let the patient know that it's going to be a little bit painful. I have 2 IVs, oxygen, monitor. Once it captures, then you'll let the patient know that it's going to hurt a little bit, that we have to keep this on until hopefully they go to the cath lab for a pacemaker, and then you can turn your patient over to the cath lab hopefully. For defibrillation, so you have an unresponsive patient that you hopefully are doing CPR on. You should be doing CPR on. You have defib, or you can have a VTAC without a pulse. So that may be defibrillated. So again, you're going to turn your monitor to the red on defib. You're going to start probably with 120 joules and charge the button, and then hit go and give them 200 joules. So you'll have doctor, RT, code card, 2 IVs, monitor, and CPR, and then IV medications. And you're going to have your patches on. You do not have to have the 3 leads on to defib. Select your energy from 120, and then the next shock will be at 200. Then continue course patient care depending on what the rhythms become. So 2 minutes of CPR, labs, X-ray, intubation. Make sure you're bagging your patient well, doing 30 compressions to 2 breaths. Completed, and we will keep going with CPR until the rhythm changes, or we get a pulse back, or unfortunately the patient is declared. But make sure you have all your equipment ready to go, your meds. Maybe get an epi every 2 minutes, or 3 to 5 minutes, and doing a rhythm check every 2 minutes. After the second shock, you might consider some amiodarone. And so I think I've covered everything. Just make sure on the pad you have the correct pad placement. Thank you for coming.